Dexamethasone, included in the ReadySharp Dexamethasone Kit, is used to treat a variety of conditions such as arthritis, blood/hormone disorders, allergic reactions, skin diseases, eye problems, breathing problems, bowel disorders, cancer, and immune system disorders. It belongs to a class of drugs known as corticosteroids and works by decreasing the immune system's response to reduce symptoms like swelling and allergic reactions. The injectable form of dexamethasone is used when a similar drug cannot be taken by mouth or when a very fast response is needed, especially in patients with severe medical conditions. It's important to talk to your doctor about the risks and benefits of using dexamethasone, especially if it is to be injected near your spine, epidural. Rare but serious side effects may occur with epidural use. The daily dosage and optimal timing of this medication should be determined by your healthcare provider based on your specific condition and needs. When using the ReadySharp Dexamethasone Kit, the medication can be administered through injection into a vein, muscle, joint, or skin area as directed by your doctor. It's important to carefully follow your doctor's instructions, and the dosage will be based on your medical condition and how you respond to treatment. Your doctor may also reduce your dose gradually to minimize side effects. If you are administering the medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using the medication, visually check for particles or discoloration. If you notice either of these, do not use the liquid. It's important to also learn how to store and discard the medical supplies safely. It's crucial not to stop using this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. You may also experience symptoms such as nausea, dizziness, weakness, or muscle/joint pain. To prevent these symptoms, your doctor may reduce your dose gradually. If you experience any new or worsening symptoms, make sure to report them to your doctor right away. And finally, if your condition does not improve or worsens, be sure to inform your doctor. Some common side effects may include stomach upset, heartburn, headache, trouble sleeping, increased appetite, or pain/redness/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. Seek immediate medical attention if you experience any serious side effects, such as signs of infection, bone/joint pain, irregular heartbeat, vision problems, unusual weight gain, swelling, symptoms of stomach/intestinal bleeding, mental/mood changes, muscle weakness, slow wound healing, or seizures. This medication may rarely cause an increase in blood sugar levels, potentially causing or worsening diabetes. Contact your doctor if you notice symptoms of high blood sugar, and if you already have diabetes, monitor your blood sugar regularly as directed. A severe allergic reaction to this drug is rare, but seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects not listed here. Before starting to use the ReadySharp Dexamethasone Kit, it's important to let your doctor or pharmacist know if you are allergic to it or have any other allergies. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. It's also essential to inform your doctor or pharmacist about your medical history, especially if you have had infections, kidney disease, liver disease, mental/mood disorders, mineral imbalance, thyroid disease, stomach/intestinal problems, high blood pressure, heart problems, diabetes, eye diseases, bone loss, or blood clots. Using corticosteroid medications for a long time can make it more difficult for your body to respond to physical stress. Therefore, it's important to inform your doctor or dentist if you are using or have used this medication within the past 12 months before having surgery or emergency treatment, or if you get a serious illness/injury. It's also important to know that this medication may mask signs of infection, making you more likely to get infections or making current infections worse. Therefore, it's important to stay away from anyone who has an infection that may easily spread and talk to your doctor if you have been exposed to an infection. The medication may also cause stomach bleeding, and daily use of alcohol while using this medicine may increase your risk for stomach bleeding. It's important to inform your healthcare professional that you are using dexamethasone before having any immunizations/vaccinations and to avoid contact with people who have recently received live vaccines. Older adults may be more sensitive to the side effects of this drug, especially bone loss/pain, stomach/intestinal bleeding, and mental/mood changes. For children, this medication may slow down growth if used for a long time. Therefore, it's important to consult the doctor or pharmacist for more details and see the doctor regularly so your child's height and growth can be checked. During pregnancy, this medication should only be used when clearly needed, as it may rarely harm an unborn baby. Infants born to mothers who have been using this medication for an extended time may have hormone problems. It is unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that can affect how your medications work or increase your risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with ReadySharp dexamethasone kit include aldesleukin, drugs that can cause bleeding/bruising, and certain cancer drugs. It's important to talk to your doctor or pharmacist about any potential interactions. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Make sure to ask for more details from your doctor or pharmacist. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much of the medication and is experiencing severe symptoms such as losing consciousness or difficulty breathing, it is important to seek immediate medical attention by calling 911. Alternatively, you can also contact a poison control center for assistance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to remember not to share this medication with others. If you are using this medication for a long time, it's important to have regular lab and/or medical tests done, such as blood mineral levels, blood glucose, complete blood count, bone density tests, blood pressure, and eye exams. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Using this medication for an extended time may cause bone problems, osteoporosis. To reduce the risk of bone problems, it's recommended to make lifestyle changes such as doing weight-bearing exercise, getting enough calcium and vitamin D, quitting smoking, and limiting alcohol. It's best to discuss with your doctor the lifestyle changes that might benefit you. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at the regular time. Do not take double the dose to make up for the missed one. Be sure to check the product instructions and ask your pharmacist about the best way to store this medication. Always keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or pour them down the drain unless instructed to do so. When this product is expired or no longer needed, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.